Welcome back to EASD TV. Now, most of the diabetologists here are used to coping with difficult situations, but we had a session in this program about the difficulties of managing diabetes during disaster and worse. So let's talk to two people who have first-hand experience. And let me introduce, first of all, Butheinah Al-Sharafi, and from Sana University in Yemen.
Yes.
And also Brij Makkar, who's a practicing diabetologist from New Delhi in India, and also president of the Research Society for the Study of Diabetes in India. So let's start with you. I mean, what kind of problems have you had when you have big disasters like earthquakes, like COVID, in dealing with diabetes?
So, whenever there is a disaster, there are multiple things that happen. And COVID, I think, was a glaring example what a disaster could be. First thing is, you're just disconnected from everything. You're confined to home. The people who are living with diabetes, they get disconnected from their physicians. They run short of supplies. There are a lot of people, particularly from the lower socioeconomic status, who are working more like daily wages or on short-term contracts. Everybody lost jobs. So loss of income was big issue. Fortunately, in India, we didn't have much issues relating to the food supplies because our government did a fantastic job maintaining food supplies to even poorest of the people. But healthcare system was like just collapsed, and all food resources were shifted to COVID. And this happened not in India, everywhere in the worldwide. So all hospitals were seeing only COVID patients. So if you have emergency, suppose you are a person with diabetes and you get a heart attack, it's very difficult to go anywhere because first you are in lockdown, second you go to hospital, they say we are taking only COVID. What to do? You want to go to a chemist shops are closed because everything is locked down. How to get your supplies? Now, second thing is, once you are disconnected from physician, you are not getting supplies, you're not having enough care access, you're losing money, you're losing income. Mental health issues come in. People get depressed. People are they stop taking treatment, they stop measuring their glucose, and they were at higher risk of complications. So there are multiple things which change, whenever there is a disaster. It's not just one factor that we have to look at. We have to look at overall perspective that can be had. What is the size of disaster? What is the time that it happened? What kind of impact it has on, supply chain, social linking, support systems, and so on.
And of course, in India, there are a number of natural disasters that unfortunately visit you very often, earthquakes, flooding. And is there a system in India that swings into action relating to diabetes in particular when these natural disasters hit?
In India, the healthcare system is a little different. We have a government system which is free healthcare for all. Wherever the government hospitals or government healthcare centers are there is free care for anybody walking in there. But we don't have doorstep delivery. But at the same time, we have a very robust healthcare system which is private practice. So we have private hospitals, corporate hospitals, private clinics everywhere. And they are not too expensive. Then there are a lot of charitable organizations which come to support for any of these situations. So reaching a healthcare facility is not a problem, provided it is open. But taking the example of COVID, once there was COVID, everybody was scared going to a clinic or private practice center also, because now person is afraid that if he goes there and gets COVID infection, that's a bigger challenge. So people were scared even to go to clinics. So immediately, in no time, I think within a week's time, people were already on teleconsultation platforms. So people were talking to their physicians directly on phone and getting advice on phone. So many people. India is fortunately, technology hub also. We are at a very good pace, and we are very much in sync with newer technologies. And most of the people are having cheap smartphones. So people started connecting on, WhatsApp video calls with their physicians. So if they have to show up something like, I am seeing lesion here, or I want to show you what is happening to my hand, so that smartphone worked like a video consult. And in no time, people were getting connected back to their physicians. And the physicians also created a system where they could reach their physicians immediately. And similarly, there were online, medicine supplies. So there were some priorities given to such channels which are supplying medications, food to people living at home. So everything got into action.
Now, for you, so natural disasters are bad enough, but for you, it's worse, Sana, because you've had war in Yemen for a decade.
8 years now.
8 years, yes.
Yes.
And it must have felt like
like 100 years.
Yeah, like 100 years.
Yes.
And you have no infrastructure.
Yes.
You have absolutely nothing. How on earth do you cope?
Well, we try to do the best we can with what we have available. In the beginning, it was difficult when the bombing started and so on. But little by little, life started going back to the new normal, we can say. Not normal, but the new normal. You get used to living with what you have available. This medication isn't available, we go to another medication. This isn't, we don't have access to this, we do what we have access to. We don't have all the blood tests or workup that we need for a patient. We do what we have. We make use of what we have.
So give us an example of a kind of something that you've been forced to do that you wouldn't have done before in that way.
Well, for example, when the bombing started, the electricity went out completely on the city. So we were without electricity. Whether you had money, you didn't have money, there was no electricity. And they sort of took us by surprise, so we didn't have time to prepare for that. So patients that were on insulin were very were worried. What are we going to do with our insulin? How are we going to keep it from going bad without any refrigerators, without any... and little by little, patients, sort of found a way to keep their insulin. They'd put it in a bottle of cold water. They'd try to wrap it in a wet cloth and so on. Things they weren't doing before. They just sort of became creative and started trying to find a way to keep their insulin safe so they could use it. That was something we never thought about before. It was never a problem. Just stick it in your refrigerator and that's the end of the story. But when we were suddenly in that situation, and patients don't understand that they can even keep it outside for a while, nothing's going to happen to it, because the area where I'm from, it never gets too hot. The temperature is quite nice. I mean, it rarely goes up to the 30s. But they didn't understand that. They thought, okay, my insulin has gone bad. I haven't had it in a refrigerator for a day. And that was difficult, trying to get the message out to the patients that it's okay, nothing's going to happen to your insulin if it stays outside, with the weather not being that hot. It can last longer than you think.
And what about access to drugs?
I think insulin was always available. We never had a problem with it. But a lot of the oral medications, sometimes, we'd have to switch to another medication because that medication is not available. Most of the medications were imported to Yemen, but the area we were in, because it was sort of surrounded and we couldn't have access to many of the medications, we'd have to just keep switching the patients to what we had available. Okay, we don't have this, let's try this. This is available now, why don't you use this medication? And so on. So we were sort of juggling things, it's not...
And are there things that you've learned from that actually have been valuable? In terms
we've learned, to sort of deal with what we have, you know. A lot of the analogs, we had problems with them, insulin analogs. We always had mixed insulin. I think there was never really a problem with mixed insulin. But patients that were on analogs, times they're available and other times they're not available. And so we have to learn. The patient calls you, okay, I can't find regular insulin, what should I do? Tell me what to do with my mixed insulin, or so on. So we're just getting used to changing, okay, do this, you know, change your dose to this, and so on. So, you know.
And how were you communicating? Was it mainly by mobile phone?
By phones, yeah.
Yes.
Yeah.
Because as you say, the mobile phone has been an extraordinary development.
Yeah,
I mean,
definitely. Yeah.
you know, without it, we would really be in even more trouble.
Yes.
What could we be doing that would be helpful for Yemen?
I think if, supplying the necessary drugs, also patients, the equipment, you know, testing and so on, these are not usually supplied by the government. And patients, especially with type 1, sometimes have problems. They can't afford to buy their supplies to test their blood sugars and so on. And we often find a large numbers of patients that go for months and sometimes even years without checking their blood sugars. And that's really tough. If they could get it for free, the supplies and so on, that would help a lot. You know, they just take their insulin dose and whatever happens. I mean, that's it.
What happens in India in disaster situations about things like test strips because you've got a very big population,
yes,
and it's very rural.
So in India, there are challenges, and those challenges are at times our strengths also. So we have people who can manage things in very scarce resources. And now we have primary health care going largely to the remotest areas of India. Now, and there you get all the essentials. It is not that you don't get it. Problem is, can you connect with those centers during the time of COVID? So I think more important now is what should we do during the time of disasters? How should we prepare for it? So preparing involves, one, that you should have facilities and resources stocked for at least 4 weeks, 6 weeks, everywhere across country at frequent distances. So, and it is not that the whole country normally goes into a disaster. It's usually a part which is affected more, part which is affected less. So suppose a part is affected, all the surrounding areas can immediately move to help. In India, good thing is there are a lot of organizations, whether they are religious, whether they are NGOs, whether they are medical societies, physician societies, everybody becomes active during those times and everybody comes forward to help. So even we have temples. So temples will start distributing food to all these people. They will the gurudwaras, the temples, they will start giving shelter to people who are displaced. They will find resources and give them medications also. Similarly, the medical organizations, like we have Research Society, we have Diabetes India, we have, good diabetes societies. So they will start working on education part, how to handle these situations during the COVID. Don't get into panic mode. If this is happening, just do this. Short messages are going. Like we had COVID, so immediately our society gave a circular for the people with diabetes that this is what is likely to happen. And don't panic, just follow these instructions. So those things become important.
But the trouble is for you, Butheinah, but you didn't have any warning. So there was, even if you'd had stockpiles, they wouldn't have lasted for long. And you find yourself with, not being able to get any supplies coming in. So does that make you dependent on for instance, the UN? Or who is
I think the WHO is the one that supplies us mainly with insulin, the Ministry of Health. And also then lots of areas, there are some of the non-profit organizations, Doctors Without Borders and so on. They supply the insulin there in different areas in addition to the WHO. So in all the different governorates, there's a major hospital that will distribute insulin, for example, for patients who need it. But for oral agents, the only oral agents that we can get for free are metformin and glibenclamide, whereas all the other medications, patients have to buy them. Nobody provides them with these medications.
It's a very difficult situation, isn't it? And I commend your courage and your fortitude in dealing with this over so many years, because it's just so wearing to do it for so long. I mean, at least with COVID, there was always going to be an end. But this for you seems without end.
Well, yeah. I mean, things have gotten better. I mean, we have electricity now, we have water, we have so on. But it's still, the unrest is there. Hopefully, we'll have peace soon.
Well, we'll hope for a year in which things get better for you and for India. We'll try and avoid natural disasters and give us all a bit of a break and time to prepare. But preparation is key. Thank you so much for both of you for joining us.
Thank you.
Thank you.
Thank you so much.
And we'll have more for you in just a little while.